So the name of my article is called "The Suitability of Caffeinated Drinks for Children: A Systematic Review of Randomized Controlled Trials, Observational Studies, and Expert Panel Guidelines." The increased availability of caffeinated drinks raises questions about the level of caffeine that is appropriate for children, as well as the benefits and risks associated with their consumption. Using the preferred reporting items for systematic reviews and meta-analysis guidelines, the systematic review evaluates evidence from randomized controlled trials investigating the effects of caffeine on cognition, behavior, mood, and exercise performance in children. Observational studies and expert panel guidelines are also discussed. So in this research, they talk about how caffeine and children, if the caffeine is really the best thing for them, they study basically what they do, pretty much, and how caffeine affects them. The results were 109 studies were found, with 11 randomized controlled trials and 13 observational studies meeting the criteria. High caffeine intakes are greater than 5 milligrams and the body weight day were associated with an increased risk of anxiety and withdrawal symptoms. However, smaller amounts were not linked with such effects and may not benefit cognitive function and sports performances based on adult studies. The evidence suggests that children and adolescents should limit daily caffeine consumption to 2.5 milligrams per day body weight, equating to 1 or 2 cups of tea or 1 small cup of coffee. Lower contributors of caffeine, such as tea, may be more appropriate for children because they contribute to daily fluid intakes and provide flavonoids. By contrast, caffeinated soft drinks may be less suitable options for children as a result of their acidity, higher caffeine content, presence of added sugar, in some cases an absence of bioactive compounds. So the conclusions of the study were more studies are needed to determine the intake that represent a risk and whether there may be benefits for alertness and sports performance with moderate intakes of caffeine.